everyone, welcome. Today we're going to talk about something that affects far more workplaces than many people realize, but particularly affects ours: sharp safety. When people hear the word needle stick injury, they often picture a hospital or a clinic, but in reality, sharps can be found in client rooms, kitchens, laundry, in housekeeping areas, in storage areas, in our offices, and in community settings. By the end of this training, you will know how to recognize sharps hazards, prevent injury, respond immediately if an exposure happens, and access the right medical and workplace support. Our goal is simple. Everyone deserves to go home safe at the end of every shift. Sharp safety is not only the responsibility of nurses and healthcare providers. It applies to every program or building that may use, handle, clean around, or unexpectedly discover a sharp. Today we will focus on our practical outcomes. First, recognizing hazards. Second, responding correctly in the first few minutes. Third, reporting the incident and getting medical assessments. And fourth, preventing future injuries using the strongest controls available. This training supports our workplace procedures. Staff should always follow the current George Spady Society protocol and supervisor direction. We will keep the training structured. We will begin by understanding the danger of sharps, including the broad range of items that can cut or puncture skin. Then we will move into immediate first aid. After that, we will cover medical care, reporting, and support. We will finish with prevention, including the hierarchy of controls, safe handling, cleanup, disposal, and routine practices. Before we talk about prevention, let's make sure that we're using the same definition. A sharp is any object capable of cutting or puncturing the skin. Medical needles and syringes are the most obvious example, but the definition is actually much wider. Scissors, broken glass, razor blades, utility blades, staples, push pins, exposed wire, splintered wood, damaged metal may all become sharps hazards. Contaminated needles present the greatest infection risk, but even a clean sharp can cause a painful injury and create an exposure pathway. This broad definition matters because sharps hazards exist throughout all of our facilities. In food services, the hazard may be a knife, a skewer, a broken dish, or a can lid. Housekeeping and laundry staff may find a needle, a lancet, or a razor, hiding in bedding or clothing or in the garbage. Office staff work with staples, push pins, paper cutters, and damaged equipment. In clinical and client areas, hazards include needles, maybe broken vials, or other medical sharps. The main takeaway is that everyone, regardless of department, regardless of building, and regardless of program, needs to recognize the hazard and know how to respond. At first glance, a needle stick may look like a very small injury. The concern is that a puncture creates a direct route through the protective barrier of the skin. If blood or another potentially infectious fluid is present on the sharp, that material can enter the tissue. The level of risk depends on several factors, including whether the sharp was used, the source person's infectious status, the amount of blood involved, the depth of the injury, and the type of device. Every exposure should be assessed rather than judged by the size of the mark alone. These figures help put the risk into context, but they have to be explained carefully. They apply only to exposure to blood from a source known to have the infection. For hepatitis B, the risk has historically been estimated at 6 to 30% for a susceptible, unvaccinated worker, depending on the source's infectiousness. Hepatitis B vaccination is therefore a major protection. Current CDC guidelines estimate the average risk for hepatitis C infection after exposure is about 0.2%. The average risk for HIV after a needle stick from HIV-infected blood is about 0.3%. Risk varies by the device, the injury depth, the amount of blood, and source factors. Most occupational exposures do not result in infection, but everyone needs prompt assessment. When people picture a needle stick, they often imagine an injury during an injection. Many injuries actually happen afterwards. A worker may attempt to recap a needle. A housekeeper or a laundry employee may reach towards a hidden sharp. Someone may try to place one more item into an overfilled container. Or a used sharp may be left on a table or on a cart. These events are not simply about someone failing to pay attention. Good prevention looks at equipment, container placement, workload, cleanup procedures, communication, and training. Despite our best efforts, an injury can still happen. Imagine that you are cleaning a room, changing a garbage, assisting with client care, or picking up supplies when you suddenly feel a sharp poke. It's normal to feel startled. The important thing is not to panic. The correct first aid steps are very straightforward, and acting quickly gives you the best protection. If the injury happens while you are wearing gloves, carefully remove them using the proper dolphing technique. If the wound bleeds naturally, allow it to bleed gently for a few moments, but do not squeeze it. Wash the area thoroughly with regular soap and warm running water, then cover it with a clean dressing or bandage. The steps are simple. Remove gloves safely, allow natural bleeding, wash, and cover. Once first aid is complete, report the incident and seek urgent medical assessment. What you do not do is just as important. Do not squeeze or milk the puncture. Do not cut the wound or scrub it aggressively. Do not use bleach, hydrogen peroxide, or other harsh chemicals on the site. These approaches can irritate or damage tissue and do not replace proper washing. And do not wait to decide whether the injury is serious enough. A small puncture can still require assessment. So complete first aid, report immediately, and seek care. Not every occupational exposure involves a puncture. Blood or other potentially infectious body fluid may splash into your eyes, nose, or mouth. If that happens, flush the affected area immediately with clean running water. Use an eye wash station when one is available. Continue flushing thoroughly. Then report the exposure and seek medical assessment right away. Treat a splash to a mucous membrane with the same urgency as a needle stick. Once immediate first aid is completed, the next step is medical assessment and reporting. You do not need to decide by yourself whether the exposure is serious enough. An external qualified healthcare professional will assess the type of exposure, the device, the source information, your vaccination status, and whether testing or preventative treatment is recommended. After first aid, do not wait until the end of your shift or the next day. Notify your supervisor immediately. You will then call HealthLink at 811 and they will guide you to the nearest emergency department. Sometimes they can help with which one has the least wait. Some preventative treatments are time sensitive, including HIV post-exposure treatments. So the sooner it starts, the better. After notifying your supervisor and as soon as it is safe to do so, please complete an internal incident report while the details are still fresh. Record the date, the time, the exact location, what task you were performing, the type of sharp, whether it appeared used, the depth or nature of the injury, the first aid completed, and where you are going or where you sought care. Reporting is never about blame. It creates a documentation needed for medical follow-up, workplace investigation, and support. WCB Alberta advises workers to report an injury as quickly as possible after telling the employer when treatment is required beyond first aid and time is missed from work. The employer has a separate reporting obligation also. Near misses are important safety information. A used needle on a table or in a garbage, or an overfilled container, or a cleanup process that nearly caused contact should all be reported. No one may have been injured, but the conditions for an injury were present. Reporting allows the organization to change a process, relocate a container, improve supplies, clarify responsibilities, or provide training before someone is hurt. A strong safety culture values this information instead of waiting for an injury. A sharps exposure can be stressful even when the physical injury is small. It is normal to feel anxious while waiting for results or follow-up. Support may include your supervisor or manager, the healthcare professionals completing the assessment, human resources or workplace safety, WCB when a claim applies, extended benefits, and the employee assistance program. These resources can help with medical costs, follow-up, time away from work, and confidential emotional support. Staff should not have to navigate the process alone. The best response to a sharps injury is to prevent it from happening. Most injuries are preventable when the workplace combines safe equipment, clear procedures, good placement, appropriate staff training, and personal protective equipment. We will use the hierarchy of controls to organize those prevention strategies from strongest to weakest. The hierarchy of controls help us to choose the most reliable prevention. Elimination is the strongest. Can the task be completed without a sharp? Substitution asks whether a safer method or device can be used. Engineering controls physically reduce exposure, such as safety engineered medical sharps, approved containers and tools for retrieval. Administrative controls include procedures, training, inspections, communication, and reporting. PPE is the final layer. It may reduce the impact of an exposure, but it does not remove the sharps. Alberta OH&S require hazards to be eliminated or controlled using the hierarchy. And Part 35 sets specific requirements for medical sharps, training, and post-exposure procedures. When you are actively using needles or medical sharps, there are several non-negotiable rules. Never recap a needle. Alberta's OH&S code specifically prohibits it. Never bend, break, or manipulate a used needle. Never reuse a needle. Before beginning, identify the disposal container and make sure it is within reach. Dispose of the sharp immediately after use. Use the safety engineered sharp and activate its safety features when that is the device provided. Alberta requires safety engineered medical sharps unless the device is clinically inappropriate or not commercially available. In the supervised consumption service or other unique settings, this device may not be available. Cleanup is one of the most common times for hidden sharp injuries. Carry garbage and linen bags by the loop and away from your body. Never hug a bag against your chest or legs. Never place your hand inside a bag, a box, a laundry container, or a wastebasket when you cannot clearly see the contents. If you find a sharp, do not pick it up with your bare hands. Use the provided tongs, forceps, dustpan, or retrieval tool and place the sharp directly into an approved container. Wear the footwear, gloves, and other PPE identified for the task. If you suspect a sharp is inside an item, stop handling it and follow the workplace procedure. A sharps container only protects workers when it is correctly placed and used. Alberta requires containers to be located as close as reasonable to where sharps are used and to have a clearly defined fill line. Keep the container upright and stable. Replace the seal when it reaches the manufacturer's fill line. Guidance commonly uses about 3/4 full when there is no mark line. Never force more items into a full container. Push the contents down or attempt to remove an item after disposal. Report an overfilled damaged, or poorly placed container immediately. These prevention strategies come together under routine practices, the Canadian term that replaced the older concept of universal precautions. Routine practices are used for all clients at all times in all settings. The specific measures are based on a point of care risk assessment, the task, the environment, the client's presentation, and the likelihood of contact with blood, body fluids, contaminated items, or sharps. This approach means we do not make assumptions based on a person's diagnosis or appearance. We use consistent, evidence-based safe practices that protect clients and workers without stigma. As we finish, remember 4 actions. Prevent injuries by recognizing hazards and using the strongest controls available. If an exposure happens, wash or flush immediately. Seek urgent medical assessment and do not wait. Report the injury or near miss so you receive support and the organization can learn. Sharp safety does not belong to one department. It is created by every safe decision, every container replaced, every hazard reported, and every procedure followed. Before returning to work, ask yourself, what is one thing I can do today to make my work area safer? Thank you for your attention and your commitment to protecting one another.